Medical tourism is an expression which has been made popular in recent times by its connection with a steady flow of Nigerians trooping out of the country to seek assistance with their health struggles, mainly because of the absence of relevant facilities in the country. It has progressively become a case of double jeopardy for needy Nigerian patients because of Nigerian doctors and various other medical personnel leaving the country to seek greener pasture in more advanced climes where improved remuneration and state-of-the-art facilities continually beckon. Joining us now to have a quick chat around the need to curb medical tourism in Nigeria, the brain drain, and the need for revamping medical and health science educational institutions in the country is Professor Adesegun Fatusi, who is also the Vice Chancellor of the University of Medical Sciences in Ondo State. We'd like to welcome you to the program this afternoon. Thank you for joining us.
Thank you very much. It's a pleasure to be here.
All right. Can you talk to us really briefly about UNIMED? It's Nigeria's first specialized medical university. Can you tell us how your involvement came to be and why it's so special?
Thank you. So the University of Medical Sciences, like you said, is Nigeria's first specialized health and medical sciences university. Founded now 7 years ago, 2014, December 8, was when it was signed to law. And the coming in of UNIMED had opened up a new vista in medical education in a very specific way. So UNIMED had come as a specialized university to fill a weak gap that remains in the Nigerian educational sector, in the landscape of medical education. And in the last 7 years, indeed, we have shown that there's a need for specialized universities. To just show you a few examples, if you recall the recent problem we had in Kaduna, the bomb blast, one of the things that will naturally happen, there will be trauma. People might lose their limbs and other things. Nigeria has not had one single faculty of medical rehabilitation in the whole of its history. UNIMED started the first faculty of medical rehabilitation. And we'll take a look at things like prosthetic and orthotics. So someone who has a damaged limb may need prosthetics. There's no prosthetic training program at degree level in this university, outside one Federal University of Technology. So UNIMED has now a first faculty of medical rehabilitation where we are looking at the totality of the medical rehabilitation field. Before the oncoming of UNIMED, there is no program in speech therapy at degree level. There's none in audiology at degree level. There was not even what we call the BMAS, the benchmark minimum standard. Because without that, you can't start a program. It didn't even exist. But when UNIMED came, we proposed that to NUC. We started working with NUC on that. And now today, that's a reality. Universities can then begin to think about some of this program. UNIMED established the first full-fledged School of Public Health in this country. So our coming had given a new dimension to medical education. And our idea is not to do more of the same, but rather, one, to fill the gap that exists. Two, to ensure that we bring innovation and we bring in a mindset that will lead to curbing some of these issues we're talking about, both medical tourism and also address part of the brain drain challenge.
Well, I do applaud the moves you're making to boost the facilities, to make it more innovative and whatnot. But while this is happening, we have those in the medical field leaving at an exponential rate, more or less. And we have destinations like Canada, Dubai, and even the United Kingdom that are offering them more, mouth-watering career opportunities. And for every Nigerian, or for every 10,000 Nigerians, there are 4 doctors. So while you're trying to, bring this innovation in, people are going out. How are we going to necessarily curb this medical tourism? Because in the end, to get the treatment one will need, those hands that might be required have already taken flight. They've already departed from the country. So they will have to go and seek that medical attention outside of the country. So how are you going to bridge this gap? Because
very, very important question. Thank you for that question. So people are leaving, and believe me, you can't stop people leaving easily, particularly given the state of the economy.
Yes.
When we talk about brain drain, there are 2 major factors. the pull and the push. The pull is better price, better salary, better infrastructure. The push is what happens in our environment. Insecurity, low salary, you don't have equipment to work. So stopping that in the immediate will not be what we need. What we need is to ensure that, number one, we can produce a high number to try and close that gap as soon as we can. Number two, to ensure that we have a bridge so that those who go out, we don't lose them totally in this way. For example, in the University of Medical Sciences, we have people who are not based in this country, who are Nigerians, who are specialists outside, who are still on our teaching list. I'll give you one example. Professor Londa wrote to me in Leeds Pathology. Is on our, so they are out there getting the money, also getting the experience, and they are bonding with us and working with us to use that knowledge to also benefit those who are trained at home. They also help us facilitate access sometimes to more research grants, more partnership, as well as access to equipment. So we may not be able to stop the brain drain immediately, but if we produce high enough number, we'll close the gap. If we are able to do some strategic approaches to network with those who are going out, it will not end up as a loss. It will end up as a brain gain, as brain gain. And that's the kind of innovative approaches that we must look at. But we must also improve what we are doing at home and give young people the feeling that they can be fulfilled. And that's why innovative education comes in, the kind we are trying to offer in UNIMED. To know that even while you are here, there are a lot you can impact, there are a lot you can do, there are a lot you can just creatively achieve in our environment. And that's why we have, for example, we have a Center for Molecular Biology and Medical Genomics that is about taking research to a higher level. So all the issue around testing for COVID-19, all the issue around Lassa fever, which is a challenge in many states, is something we are able to do. And we are getting more equipment into cancer research, molecular biology research. Those will sometimes keep people. It's not just about money. It's about fulfillment in terms of career. And so those are some of the ways we believe that we can address those issues. And we are addressing those issues, actually.
Well done.
Now, pharmacy is a critical part of medical sciences. So what are the plans to improve pharmaceutical studies and encourage innovation, considering what we witnessed during the COVID-19 pandemic? I'm talking about access to medication and hoarding by developed countries, which were underscored by the increased talent flight out of Nigeria and Africa.
Okay. Again, a great question. Thank you. So let me take one step back. In UNIMED, we have like 26 courses now. All professional courses you can think about in the health sector. Medicine, final year medicine, we've graduated nursing, physiotherapy, and all that. However, we now have pharmacy. Pharmacy is the only professional group we don't have right now. But we are going towards there. Why am I laying the emphasis on that? To start pharmacy takes a lot of resources. You need equipment, you need materials, and all that. So for us, we are just breaking to that because we realize if you go to the hospital as a patient, it's not just to see the doctor. You want to live with drugs or you want to live with injections, something. That's the pharmaceutical connection that is so central. Now, what can we do and how can we do it? I will highlight one critical experience that I think is important. Take a look at malaria. Malaria is the greatest killer in Nigeria. The drug we use today is artemisinin-based therapy. Artemisinin-based therapy was discovered based on a plant in China, the sweet wormwood plant, which gave the woman who led the team Nobel Prize in 2015 in physiology. Now, what's the point here? It's not just about pharmacy as westernized, customized idea. Nigeria, we have a lot of herbs. We have a lot of plants. Our people have used this for how many years? Thousands of years. But we have not made deliberate effort to bring this to modernity and to use innovation to recreate that world. Imagine what artemisinin had meant for the world. Millions of people have been saved. Honor for China and the amount of money. So for us, pharmaceutical, and talking about other COVID and other things, it's not just about using drugs. It's about we must get to the point now where we must bring science and innovation to turn around discovery around drugs so that our people can use it. Our people believe in those drugs. So we can use power of science to change it. So for us, for example, we have a Center for Herbal Medicine and Drug Discovery. Because one of our focus as a university, we feel that as a specialized university, we have an historical duty, like I said, to cover the gaps. One of those gaps is how do you begin to look at what's available? So when there was chloroquine resistant, what do you do? And that's the lady, and our group did was, they simply went back to the literature in China. What had been written like 1,600 years before then, 340, was when documentation was done. And they then went on to say, look, let's look at the herbs in China that they have used before. And that's how they came about this artemisinin. And that's the kind of pathway Nigeria need to tread. And that's the kind of pathway we believe in as University of Medical Sciences, to break into the bigger light using innovation and science to transform the world of pharmaceuticals, which is where we've just gone now. We laid our foundation for our faculty in December last year. And so that's our approach, and that's our vision.
And I think that's quite genius. We do have a historical duty to use the plants and herbs that have existed for our benefit for thousands of years, and it's great to know that the professionals are already on top of that. But let's talk briefly about your trusteeship. You recently got appointed to the board of the Olu Akinkugbe Pharmacy Education Trust. Can you tell us a little bit about this organization and all the importance that they have?
First of all, I honestly feel very honored to be part of that board. I mean,
congratulations.
A couple of things that come my way in life, but that I particularly treasure is because it's a board of 8 like-minded professionals whose agenda is to use science and innovation to affect the future and to turn things around in the area of pharmacy and the bigger world of medicine. And this board is led by no less a person than Prince Julius Adewale Adelusi, former Nigerian Minister of Health and a phenomenal figure. And if you look around that board, 3 people on that board are fellows of the Nigerian Academy of Pharmacy. We have boardroom guru, at least 3 of them are boardroom guru. You know, the likes of Prof A, the like of Oyebode, they're the kind of people on that board. So these are people who are very focused, visionary, and who had accomplished across many areas. So this board is meant to be a transformative platform for the totality of pharmaceutical education. And the beautiful thing about it is that it connects with the person of Olu Akinkugbe. You know, Olu Akinkugbe is a phenomenal figure in the area of business. But people forget sometimes that he is a pharmacist first and foremost. And so the Olu Akinkugbe Trust Fund brings together his 3 dimensions of life. One is strong interest in education. He's been on the board of University of Ife, like 1960-something. He has a prize named after him, University of Cape Town. He was pro-chancellor, the business school. And that's one side. But the other side is business. But there's also the whole issue around pharmacy. He was director of Palm Pharmacy, one of the very first indigenous pharmacy. But also, he's a community man. So those 4 agendas are brought together in the Olu Akinkugbe Pharmacy Education Trust Fund. So, and that's why, for me, it's a great honor to be on that board.
Professor Adesegun Fatusi, Vice Chancellor, University of Medical Sciences in Ondo State, thank you so much for joining us on Newsday.
Thank you.